also working in Zalega Refugees Camp, where protect refugee children. So we are working with UNHCR.
We have this program. So in YONECO, our main target group are youth, women and children because they are most vulnerable to violence, neglect and abuse. So this is the YONECO FM. This is one of our to reach out to the people
That includes young people who speak themselves on the radio.
So I'll give them an opportunity to say something about it.
Like we said, they're doing an outside broadcast. They are live on YONECO FM as we're speaking right now. So we have child presenters for violence programs on the radio.
My name is Shawa. I am 10 years old. I live in Zomba at Matawale. As UNICEF, what is your response plan to the report?
My response plan is to listen to children, to do the things that you suggest can make a bigger difference in preventing and addressing violence. And that's why your voice is so important. And I want to keep in contact with you. You are 10 years, I'm 20 more or less. But you are a champion, and I want to continue to work with you and your friends.
Contributing to our interventions on child labor. We have a teacher who's also providing psychosocial support, assisting the student when they go back to school. They actually receive some psychosocial support from the teachers. We also have a member of Mother Group, which is a grouping, whereby it's a group of mothers who actually provide the necessary psychosocial support, even counseling to students and learners on what is actually happening or what they are experiencing in life. And this is the child protection in communities. Under the child protection in communities, we are having a number of interventions to highlight the child marriages program where we engage local leaders in the fight of child marriages. We also have the child trafficking program, which looks at preventing child trafficking within Malawi and beyond Malawi. You know, the Youth Drop-in Centers is more or less like an outreach program whereby young people and children can go and access different services. Even when they access those different services, the psychosocial support and the various methods they use, they can actually be free to talk more about the violence which they are experiencing. Those are some of the cases which we come across whereby children are actually having their hands burnt because they have taken release without permission, and then they are punished because of that's what they have done. Those people who are responsible for this have been brought to book, and they are facing the whole of the law. As you can actually see, like from January 2008 to December 2014, we have managed to receive 162,230 complete calls. We are having counselors who are online responding to various messages, various cases which are being reported by the helpline. And the helpline is also investing information on the sexual and reproductive health. Because we see that we appreciate that young people nowadays they tend to go through puberty at a very early age, so they need that information on sexual and reproductive health, information, communication and technology. We use this probably to reach out to young people. Like as you can see, this is the SMS platform which we use, whereby we can use it as an advocacy tool. We send out messages on various issues which are actually happening. We are also having the Facebook. We are also having the WhatsApp group whereby young people can actually interact on issues of violence against children, give solutions to what is actually happening. We also have a youth forum whereby people can go to the website and actually access different information and discuss ways, practical ways on how overcoming violence against children. And we regard the full participation of young people in bringing the interventions which is going to prevent violence against them. This is the website which is there, which is actually somebody can actually go to it and find more information, the various reports, the various information on violence against children, sexual and reproductive health, which I highlighted before, they can access through our website. Malawi was hit by the flood disaster, and there's a helpline, there's an outreach program for the helpline. We managed to do various interventions, reaching out to children and adolescents, providing psychosocial support to those children and adolescents, trying to stir some hope. As you can see, these are some of the helpline counselors who are actually interacting with those young people, and probably to hear their story and try to provide the necessary counseling support.
timangofuna kukulandirani ndithu ndi manja awiri kumwambo umene ofunikira kwambiri pa nkhani yothetsa nkhanza zomwe ana akuchitiridwa m'dziko muno. Popitiriza mwambo wathu, tsopano ndiloleni ndidzutse Senior Chief Mkanda kuti apereke malonje.
Ndithokoze kwambiri ayinepo amene mwabwera kudzatisonkhaniza pano pa Mchinji boma. Ine ndithokoze kwambiri chifukwa misonkhano kuno kwathu ku Mchinji kulikulu yokhala ngati imeneyi yachitikapo pampano pa ground yokhala ngati iwiri. Chimenechi ndithokoze kwambiri kuti ife kuno ku Mchinji kuchokera ku office kwa bwana DC, achipatala, apolisi, amabunga onse amene tili muno boma la Mchinji, ine ndikuti tizithokoza kwambiri kuti akuluakulu ali kuzitseko kumagediko alutikumbukira kuno ku Mchinji. Nkhanza ku ana asukulu ndizoona zikuchitika, komanso ana ambiri akulephera kumakiriza maphunziro awo si chifukwa china chimalepheresa iyani. Ndi nkhanza zomwezi, chiyambi chake ndi nkhanza basi. Nthani imeneyi yagwira kwambiri kwefe mafumu kuti tikatoka pano tikakafika ku mudziko tikakhale pansi kuitana ma ADC wathu, ma VDC kumadera kwinapo kuti nkhani imeneyi yomwe iuzana kuno mkamwa kuti anyatesana uko kuti atifotokozere kuno bwino tikakhaletewo pansi kuti dziko likamvere dziko lonse la Malawi.
Issues to do with violence against children in Mchinji are very real, and the way they are being conducted in the villages is just like it's more of a tradition to do that. But now, with the coming in of different organizations and different programs by the Malawi government and the commitment to combat this, the issues are being reported to the relevant authorities, and the culprits they are facing the law. Your Honor, the PS for Minister of Gender, Mchinji has not been idle. We have teamed up to ensure that children are fully protected against any form of violence. In the team, we have different programs. We have a career project which is being done by Global Save the Children, Total Hand Care, and YONECO. We also have the court, the Mchinji Magistrate Court, the Mchinji Police, the hospital, the social welfare department, and other organizations like Women's Hope for Change, Action Aid, and others who have shown strong commitment to ensure that perpetrators, once reported, are brought to the court. For example, just last week, one was sentenced 20 years in jail for defiling a child. A group village headman was also sentenced to about 8 years in jail for defiling his own child. When we are talking of these things, we are dealing with chiefs. We are relying on chiefs to help us spread the messages that violence against children should completely stop. And here we have a case whereby a chief himself committed this crime. Thank you very much.
Let me now call upon the Inspector General of Police, Mr. Lasted Kachama.
As we launch the study report and the response plan today, I want to inform you that police is working around the clock in partnership with the community and all stakeholders to deal with violence against children. The effort is in line with the Malawi Police policy of child protection, which aims at contributing towards reducing child rights violations by providing detailed guidelines and procedures to be followed when police officers are handling matters involving children in any capacity. The Malawi Police Service also adopted the community policing movement to promote safety and security through enhanced partnership with the community and all stakeholders.
Yeah.
resident representative to give his remarks.
My job here is very brief. I'm getting used to this in Malawi. It's just to introduce the guest of honor, the SRSG against violence. So that's my job here today. She's come from a very long way to give this speech. So can we all give her a big hand to welcome her? Marta, please step up. Thank you.
Mchinji. I came from very far because I wanted to be here celebrating with all of you. And I feel so encouraged after having visited so many different illustrations of the vivid commitment of people in Malawi to make a difference for children, and to see children with such high hopes to help in this endeavor. We have learned today, with the launch of the study that we will hear in a moment, Dr. Mary Shawa present, that we have no more excuses not to be doing things better, faster, and more effectively. And you will help us do that together. We know that children who have told their stories in this study suffer, but they also want their life to be very different and to celebrate a life without violence. So I want to encourage you all to join efforts as we are seeing here today, so that we can capitalize on the great initiatives you have promoted, and we can have a great plan to implement the actions that the study has identified. We cannot be passive. We cannot be indifferent. We want to be joyful for achieving results. Many thanks and all the best to all of you. Thank you. Troupe.
gentlemen, it's now my singular honor to call upon the Principal Secretary for Gender, Children, Disability and Social Welfare, Dr. Mary Shawa.
On behalf of the Minister of Gender, Children, Disability and Social Welfare, Honorable Patricia Kariat, I am privileged and humbled to preside over the launch of the Violence Against Children report of the study. What is shocking about this study is that 2 in every 3 persons in Malawi has gone through violence, and that is shocking. 1 in every 5 girls have been sexually abused, and the figures are so high. The unfortunate part is the majority of those who are violated do not get the necessary service they require. Possibly because we think it's normal to abuse somebody, or possibly because we believe it's part of our tradition. That is unfortunate. What is also of concern is to ask ourselves, how many people know about the services we provide? Are they aware that those services are there? Are the services accessible to the ordinary person in the rural areas? Or it's only the elite who are able to go and access a service? These questions remain. Are the services friendly? Because I recall there was a time when you report that somebody was trying to abuse you, some people would just laugh at you and you felt embarrassed that you even reported. So when you look back, you continue asking yourself, are the services friendly to anybody? It is my singular honor and privilege to officially launch the report on the violence against children and the priority strategic plan. Thank you.